Isotretinoin has been controversial for many years. It's one of the most effective medications for acne, but there are some risks. And one of the risks that's potentially gotten a lot of attention lately is IBD, or inflammatory bowel disease. And here to put that risk in perspective for us is Dr. Julie Harper, who is a private practice dermatologist in Birmingham, Alabama. Thank you for being with us.
Thank you.
Now, can you tell me, give me some advice on how you counsel patients and their parents if they're concerned about this risk of IBD?
Sure, and this is something that I deal with every single day. First of all, we should go back and review that isotretinoin. There's nothing else like it. So for people who have severe recalcitrant acne, it's really the drug of choice, and it has no other drug that would compare to that. So that's why we're willing to even take the time to tell patients about this potential risk. The risk, I think, is very low, but I can't say it's zero. There are some case reports. The first one was in 1986 of an individual who took the drug, developed symptoms of inflammatory bowel disease, stopped the drug, the symptoms went away, and then on re-challenge, the symptoms came back. And there's a handful of cases like that in the literature that are, fairly suggestive that this might be a real connection between the two. But there's not a lot of evidence out there. I think from a practicing clinician's role, what we have to do is be cautious without causing fear. Okay, so I can't tell my patients, I can't tell their parents that this is not something that could happen. But I can say, based on what we know right now, it looks like it may happen at a rate of around 1 per 10,000. So if you develop symptoms of bloody diarrhea, abdominal pain while you're on this drug, please stop it. Let me know about that. And I hope that they would do that with any drug that they took. But again, I would expect that this would happen at a very low level, potentially at a level that I will never see in my practice lifetime.
Okay. Now, can you talk about some of the lawsuits to date against the manufacturer, Hoffman La Roche, and what's happened?
Yes, there have been thousands of them, and they are really based on claims that state that the manufacturer knew about this risk and did not do an adequate job of letting the population know about it. That's what all of this stems from. And unfortunately, it appears that the first 7 of those lawsuits was lost. So it was lost against the makers of Accutane. Now, at least one of those has been overturned, so I don't know what's going to happen next, but there are many more lawsuits that are out there pending right now. It doesn't look like it's going away anytime soon.
Okay, now one of the other risks that we talked about in the session by another presenter, Dr. Del Rosso, brought up the night driving concern. Can you talk about that?
Sure. So many of these side effects are not just Accutane side effects, they're vitamin A side effects. So if you were taking high doses of vitamin A, one side effect would be night vision problems. And we certainly can see that with these systemic retinoids. And to speak to his point, that is something that we would expect to see at a much higher rate than we might see something like inflammatory bowel disease. So while we're educating our patients and doing a good job, we should warn them of that, because that could really be a safety issue for them on a daily basis.
Right, much more common.
Exactly,
okay.
Exactly.
And can you also talk about a potential risk associated with doxycycline in IBD?
Yes, that's something interesting. So and this was really done by physicians in gastroenterology. So as they were looking at these studies to determine whether or not there might be an association between isotretinoin and inflammatory bowel disease, they have to ask questions like, well, could there be a confounding variable? Maybe it's acne that is really associated with inflammatory bowel disease. Maybe it's another treatment that was taken before the isotretinoin, for example, a tetracycline antibiotic. So a study was done looking at that, and in fact, yes, there's an association between tetracycline antibiotics and the development of inflammatory bowel disease. And the one that was most highly associated was doxycycline, so that's interesting. And that's not to say to all of us, quit using doxycycline, it's to say that these are associations. Nobody has proved cause and effect, but these are associations that are out there. So before you put a big stamp on isotretinoin and say this drug definitely causes inflammatory bowel disease, back up and see what other confounding variables might be there that might be contributing to that increased risk.
Okay, and do you ever foresee a day when isotretinoin will not be as controversial as it is now?
I would love to think so. It's a lightning rod drug. It continues to draw fire all of the time. We continue to push back because it is such an effective drug. I would love to say that there will come a day when we have another drug that works as well, that doesn't have these potential side effects. But I don't know when that's going to happen. But it would be nice to see that.
Okay, thank you very much. I appreciate you taking the time.
Thank you.
This has been Damian McNamara with Skin and Allergy News Digital Network, reporting from the American Academy of Dermatology annual meeting in New Orleans.